The host sits in a room with white walls, in front of wooden shelves and at a desk with a laptop.
Hello, and welcome to Module 2 of the Indian Child Welfare Act, or ICWA, Active Efforts Learning Series.
The 5 points of intervention: pre-pregnancy, prenatal, birth, neonatal and infancy/childhood and adolescence.
Throughout this module, you'll learn about the 5 points of family intervention and how states can implement active efforts through this lens to support American Indian and Alaskan Native families, known as AIAN families, affected by substance use. To facilitate this learning experience, we've gathered questions from state child welfare supervisors and workers specific to the content of this module. Let's start with a question about the 5 points of family intervention.
A new host stands in a room with books, files, and pictures behind him.
I'm working with an AIAN family affected by substance use. What approaches can I take to achieve active efforts?
Improving outcomes for infants and their families affected by prenatal substance exposure, including fetal alcohol spectrum disorder, or FASD, requires considering the family in which infants develop, grow, and thrive. The 5 points of family intervention are key periods in time when cross-system efforts can, 1, help prevent prenatal substance exposure, and 2, respond to the needs of pregnant and parenting people with substance use disorders, as well as their affected children and family members. People with substance use disorders, or SUDs, may also experience co-occurring mental health disorders in the postpartum period. A coordinated system of care across the 5 intervention points helps ensure connection with services as early as possible.
A picture of 2 children playing together.
Coordinating and integrating community-based services and supports, both formal and informal, such as extended families, traditional healers, and cultural knowledge keepers across the 5 intervention points, helps to ensure a connection with services as early as possible. There are practice strategies throughout these 5 points of intervention that child welfare, SUD treatment, healthcare, family and tribal courts, and other community agencies can use. These strategies reinforce both tribal and non-tribal interagency collaboration while providing effective services.
I thought social workers only get involved after the baby is born. How would I help a family before they even get pregnant?
AIAN family structures are typically multi-generational and may have multi-generational homes. These strategies provide a wonderful opportunity to educate these families and increase the likelihood of preventing substance use before pregnancy. Let's begin with the first point of intervention, also known as pre-pregnancy. Providers at this stage focus their efforts on preventing SUDs prior to pregnancy by promoting public awareness while ensuring equitable access to appropriate SUD and mental health treatment. Here are 3 examples of active efforts at this point.
A graphic with blue circles representing each active effort example.
1. Have SUD treatment providers ask every AIAN client whether they intend to have a child within the next year. If yes, offer them a family wellness plan to help prevent prenatal substance exposure. 2. Provide AIAN families with information on the effects of substance use during pregnancy. 3. Ensure family and community members are trained to use widely available overdose reversal medications such as naloxone.
Once I learn an AIAN individual is pregnant, what would I do as their social worker then?
That leads us to the second point of intervention, prenatal. Providers at this stage seek to identify substance use and mental health disorders through universal screening, assessment, engagement in effective treatment services, and ongoing services to support recovery. Here are examples of active efforts at this point.
Numbered examples of active efforts on a blue background.
Ask the tribe or native urban service provider whether they have a home visitation program or classes for expectant families that teaches traditional parenting skills. Identify pregnant AIAN individuals. Screen for substance use in a manner that honors and respects that individual's strength and vulnerability, while at the same time acknowledges that this is a sacred time that signals the beginning of emotional and spiritual healing. Ask yourself, how am I building a sacred, trusting relationship with this individual? Offer a prenatal family wellness plan that provides support and services for the pregnant person and their family. Help pregnant AIAN people affected by substance use locate and obtain prenatal care, including a full spectrum doula specifically experienced in caring for pregnant AIAN individuals affected by substance use.
I see how working with a pregnant person affected by substance use before the baby comes makes sense. Are there additional things that I could or should do before the mother and baby leave the hospital?
There are numerous ways to support the mother and baby after hospital discharge. The third point of intervention, known as the birth event, focuses on identifying and meeting the needs of infants affected by prenatal substance exposure, withdrawal symptoms, and FASD. It also considers the needs of the parent or caregiver, including the immediate need of the infant for bonding and attachment with a safe, stable, and consistent caregiver. Here are 3 examples of active efforts at this point.
Active effort examples on a blue background.
Determine whether the pregnant AIAN individual received a prenatal, culturally appropriate family wellness plan, and if so, incorporate it into case decision making. In the absence of a prenatal family wellness plan, partner with tribes, CPS, otherwise known as Child Protective Services, community providers, and public health to develop family wellness plans that support infants affected by prenatal substance exposure. Determine whether the birthing hospital utilizes Eat, Sleep, Console or other culturally specific rooming in models, and if they offer it to families experiencing opioid use disorder or neonatal opioid withdrawal syndrome.
Since a baby's first months are hard on families and prove especially stressful for those affected by substance use, what can I do to lend support?
Substance use within the family can certainly cause additional stressors. The fourth point of intervention, neonatal, infancy, and postpartum, is a period when systems and providers ensure consistent access to a stable caregiver as well as a safe and supportive environment. They respond to the infant's medical and developmental needs along with each family member's SUD and mental health issues. Here are 3 examples of active efforts at this point.
A graphic with blue circles representing more active effort example.
Ask the tribe or urban provider if they have any ceremonies or classes specific to newborns or young children. Help parents locate inpatient treatment programs where options include either placement of child with parent or placement close to child, so visitation can occur consistently. Ensure the substance use treatment provider has information on the family's mental health background and trauma history, including individual and intergenerational trauma specific to AIAN families.
What other things can I do to support the family as the child gets older?
There are many things you can do. The final intervention point, childhood and adolescence, responds to the unique developmental and service needs of the toddler, preschooler, child, and adolescent who is prenatally exposed through a comprehensive, family-centered approach that focuses on both neurodevelopmental needs and preventing SUDs among adolescents. Here are 3 examples of active efforts at this point. Educate AIAN parents and caregivers on 1. The effects of substance use and mental health disorders on their child.
More numbered examples of active efforts on a blue background.
2. How to recognize substance use and mental health problems with their children. And 3. How to identify appropriate culturally specific support services.
What if, despite everyone's best efforts, the child isn't safe at home and needs to be somewhere else while the parents get the help they need?
A graphic with blue circles representing more active effort examples.
If the child requires temporary alternative placement, ask the tribe or urban provider to help identify family members who might serve as placements and also how to support them. Provide frequent developmentally guided visitation with parents and siblings. Maintain child's cultural connections with their tribe. Continue adjusting the case plan to fit the needs of the family with a focus on reunification as quickly as possible. Several states have implemented policy and practice strategies across the 5 points of family intervention to strengthen interagency collaboration and improve family outcomes. Understanding common barriers and key considerations helps communities overcome obstacles and use effective methods to enhance their work. This module has covered the 5 points of family intervention and how active efforts can support AI/AN families affected by substance use. While we went into some detail, the National Center on Substance Abuse and Child Welfare has a wealth of resources to further expand your knowledge on families affected by substance use. You can visit ncsacw.acf.hhs.gov for more information. I would also encourage you to visit the Capacity Building Center for Tribes at tribalinformationexchange.org for more resources aimed at nurturing the safety, permanency, and well-being of American Indian and Alaska Native children, youth, and families.
The ACF, Children's Bureau and SAMHSA logos,